Good morning, afternoon, or evening, everyone. So, as it has been said, I'm going to talk about the impact of mycotoxin on immune system. So, I'm not going to introduce what mycotoxin are because it's not the first seminar, but I'm just going to give you an example of the multiple effects that mycotoxin can have, and I will take the example in pigs. So we know that there are different mycotoxins, and we know, for example, that Aflatoxin B1 has its main effect on liver. It induces liver toxicity, but has also an impact on growth. As far as Ochratoxin is concerned, it more targets the kidney. Deoxynivalenol and T2 toxin are two trichotoxins, and trichotoxins are known to affect growth and feed intake, inducing anorexia. Fumonisin B1 is known, especially in pig, to target the lung, and zearalenone is known to target the reproductive tract. But as you see, all these mycotoxins have an effect on the immune system, especially aflatoxin, fumonisin, and trichotoxin. In fact, when talking about the immune system, it can be divided into two kinds of response. There is first the innate immune response. This response is rapid, but not specific. And this innate immune response involves immune and non-immune cells, such as epithelial cell, endothelial cell, and immune cells such as macrophage, neutrophils, or dendritic cell. Conversely, the acquired immune response is very specific, and it is the type of immune response that you have during vaccination, but it's slow. And the acquired immune response only involves immune cell, especially lymphocyte. So it's not possible during 40 minutes to give you an overview of the effect of all the mycotoxin on all the type of immune response. So I'm just going to give you some example. Here is the first example that the mycotoxin Aflatoxin B1 has an effect on macrophages. And as you see on this slide, on this part of the slide, you see that it reduces the effect on production of nitrogen oxide and about oxygen reactive species in a dose-dependent manner. And this leads to an increased cell death of macrophage in the type of apoptosis. So we have an effect here showing that Aflatoxin B1 decreases the functionality and increases the mortality within some immune cell. In our lab, we did quite a lot of experiments trying to investigate the effect of mycotoxin on the immune response in pigs. The experimental protocol that we used was most of the time the same. The animals were exposed to mycotoxin for 4 weeks. And during these 4 weeks, they also were vaccinated with model vaccine, which is ovalbumin. And during these 4 weeks, we look at the immune response, both the humoral immune response, which is mainly antibody, and the cell-mediated immune response, which is mainly lymphocyte proliferation. And we look at this immune response both toward the antigen we use, the vaccine that we're using, but also the total immune response, so total antibody or total lymphocyte proliferation. And here are some results that we get. Here is this experiment where we use T2 toxin and the animal receive either control food or food contaminated with 0.5, 1.3, or 2.1 microgram per kilogram T2 toxin during the 4 weeks. And they were vaccinated with this model vaccine ovalbumin, and we look at the antibody response. When we look at the total antibody response, you clearly see that there were absolutely no effect. But when we look at the specific antibody response, meaning the antibody response toward the vaccine, you clearly see that the group of animals receiving the highest level of mycotoxin had a reduced antibody production compared to the control animal or the animal receiving the lowest dose of mycotoxin. We did exactly the same response with the same experiment with another mycotoxin. Here it's Aflatoxin B1, and the animal received either control feed or feed contaminated with 0.4, 0.9, or 1.8 microgram per kilogram aflatoxin per kilogram feed. And we look at lymphocyte proliferation. And when we stimulate all the lymphocyte, we didn't have any effect. But when we stimulate the lymphocyte with the antigen that we use in the vaccine, you clearly see, especially after 2 weeks, that the animal receiving the control feed responds really well. By contrast, the animal receiving the feed contaminated didn't respond that well. So it indicates that low dose of mycotoxin decrease the antigen-specific immune response without altering the global immune response. So really, to see an effect of mycotoxin on the immune system, we need to stimulate the immune system. So as I show you here, we look at the humoral and cellular immune response for 2 mycotoxin, T2 toxin, or Aflatoxin B1. And I show you that for T2 toxin, we had a decreased immune response, especially in terms of antibody production. And with aflatoxin, we had a decreased lymphocyte proliferation. But when we look at the antibody production for Aflatoxin B1, there was even the specific antibody production, there was absolutely no effect. And when we look at the specific cellular immune response for T2 toxin, we didn't have any effect. So it really indicates that each mycotoxin acts differently on the immune response. T2 toxin affects the humoral immune response, whereas aflatoxin affects the cellular immune response. And so, if we need to characterize the immune effect of mycotoxin, we need to investigate different parameters of the immune response. So, to conclude on this first part, we've shown that each mycotoxin acts differently on the immune response. I show you that T2 toxin alters the antibody-specific production, but doesn't alter the cellular immune response, lymphocyte proliferation, and this is the opposite effect for Aflatoxin B1. So we really need to investigate the effect of mycotoxin on several parameters to be able to see what are the effects of mycotoxin on the immune response. Another conclusion of this experiment, it shows that low dose of mycotoxin decrease the specific immune response without altering the global immune response. So we really need to stimulate the immune response to investigate the immunosuppressive effect of mycotoxin. What is even more important than knowing exactly what mycotoxin are doing on the immune response is to study the consequence of the modification of the immunity on pig health. And basically, the fact that mycotoxin alters the immune response has 2 consequences. The first is an increased susceptibility to infection, and the second is a decreased vaccine efficacy. And I'm going to give you some examples on these 2 parameters. So here is an experiment that we did also in our lab with piglets that were exposed to Fumonisin B1, and they were after that infected with an oral infection with a pathogenic E. coli. And what you can see that at the end of the experiment, when we look at the number of bacteria in the intestine, there was much more bacteria in animals that were exposed to the mycotoxin. This is a log scale, so the increase was at least 10-fold to 100-fold more bacteria in the intestine of the animal that get the mycotoxin. And here in these photos, you can see here the small dots are the bacteria that were stained, and you can clearly see the bacteria that are attached to the intestine. So this really shows you that the fact that mycotoxin can increase susceptibility to infection. This is another example, still with Fumonisin B1, but here is in chicken and still E. coli infection. Here it's 21-day-old chicks that were injected with E. coli, and after the bacterial injection, they were killed, and the number of bacteria were determined in different organs, spleen, liver, or lung. And you clearly see that there was 4.9 in log 10, there was 4.9 bacteria in the control animal receiving no fumonisin, but when they received fumonisin, it was more than one log higher, meaning that it was more than 10-fold higher. And we see that in the spleen. There was also an increase, but it was smaller in the liver, and there was no effect in the lung. This is just two examples, but if we go through literature, there is quite a lot of examples that has been observed. And here is just a survey of a literature survey of experiments that have been done in chicken. So with DON and acetyl form of DON, zearalenone and fumonisin, and with Escherichia maxima, there was a decrease of CD4 and CD8 T cell in the mucosa. With also DON acetylated form, and then there was an effect after also infection with Escherichia. There was an effect with E. coli, Salmonella, Clostridia, Salmonella gallinarum, or also E. coli. So there is a lot of evidence that really the fact that mycotoxin alter the immune system will increase susceptibility to infection. Here it's a review on poultry, but I can have the same slide on pigs, for example. This is an experiment that I like to show because here it's not an experimental infection. In this experiment, what happened is that it was in a farm. They were given Ochratoxin in the feed at 1 ppm or 3 ppm. And basically what happened is in this farm, in animals that received the low dose of Ochratoxin, 2 out of the 6 animals developed Salmonella infection. And in the group of animals that received the high dose of mycotoxin, they all developed a Salmonella infection. So here it really indicates that the sanitary status of the farm was not very good because there was Salmonella around, but basically the animal receiving the control feed didn't develop an infection. Their immune system was strong enough that they can fight against the infection. But when they receive a mycotoxin, they could not fight, and then they develop an infection. And what is even very interesting in this experiment, then they did the experiment again, and they say, okay, we have a salmonellosis problem in our farm, so we are going to vaccinate against salmonella. And they repeat the experiment the same way. Here they use only the animal feed with control feed or with high level of ochratoxin. They didn't have to wait 13 days, they have to wait much longer. But after 47 days, in fact, out of the animal receiving the high level of mycotoxin in the feed, 1 developed Brachyspira infection and 1 Campylobacter infection. So basically, it really indicates that if you have mycotoxin in your feed and you don't have a good health sanitary status, whatever the pathogen that is around, the animal will catch the pathogen and will be infected by this pathogen. So this is the first set of examples that I show you indicating that the fact that mycotoxin decrease the immune system will increase susceptibility to infection. But there is also the immune system is also used during vaccination. And it has also been demonstrated that the fact that mycotoxin decrease the immunity will have an effect and will decrease vaccine efficacy. Here is some example. So here it's an experiment with aflatoxin on viral infection. So basically there was more than 600 chicks, 2 months of age, that received feed contaminated with aflatoxin, and they were vaccinated and then challenged. They were vaccinated to different infection and then challenged with the pathogen. And basically, you can see that in the first set, they were challenged with Newcastle disease. There was an increased antibody titer and leading to an increased mortality in the animal that received aflatoxin. Exactly the same result with infectious bronchitis. There was a decreased antibody titer and increased mortality after challenge. By contrast, with infectious bursal disease, there was a decreased antibody titer, but there was no effect on mortality. This is another experiment that we did in our lab with the vaccination, and it was a mycoplasma vaccination against mycoplasma. And when we look at the total antibody response, there was absolutely no effect. But when we look at the specific antibody response, you clearly see that at the end of the experiment, the animal that received the feed contaminated with Fumonisin, get a lower antibody response than animal receiving the control feed. In this case, because we are scientists, we try to look at the mechanism involved, and we see that it was because of cytokine, because there was an alteration of the Th1, Th2 balance that is really important for antibody production. And in addition, we had a decreased lymphocyte proliferation that lead to a decreased antibody production and lead to a decreased vaccine efficacy. I think that's quite important because breakdown in vaccinal immunity induced by mycotoxin may lead to occurrence in disease even in properly vaccinated pigs. And the problem also is when you get the disease, you know that you have vaccinated your animal, but most of the time you don't remember what type of feed you were giving to your animals months or 2 months earlier when you were vaccinated your animals. So if we try to conclude on this part, we can see that mycotoxin can alter several aspects of the immune response. I show you that T2 toxin alter the production of antibody, whereas aflatoxin B1 alter the lymphocyte proliferation. And this really have some consequence in terms of pig health, or even in animal health in general. It increased susceptibility to infection. I didn't show you, but there have been experiments also showing that it reactivates chronic infection. I show you that it decreases vaccine efficacy, and there are also experiments that show that ingestion of mycotoxin may also decrease drug efficacy. However, in most of the case, the underlying mechanism still need to be elucidated. I show you for Fumonisin B1, we did some experiment, and now we know what is the mechanism. It is due to cytokine production and lymphocyte proliferation, but for some other case, it's really not known. For example, the case of Ochratoxin that I show you that decrease, that ingestion of Ochratoxin increased susceptibility to several infections. We don't know exactly the mechanism. So I'm almost finished this part of my talk, but before finishing, I wanted also to tackle a new problem that is today on mycotoxin. And this is the problem of mycotoxin co-contamination. Co-contamination is a reality. It's a reality for several reasons. The first reason is that fungi produce several mycotoxins simultaneously. Because also feed may be contaminated by several fungi at the same time, and because the animal diet is composed of multiple raw material. For all these reasons, we have a co-contamination. And this is, for example, a survey that has been done in almost 10 years ago on more than 7,000 samples. And in this survey, it indicates that about 20% get low level of mycotoxin below the limit of detection. That 33% in this sample was one mycotoxin, but in 48%, they detect more than one mycotoxin. And so contamination by several mycotoxins is a rule, not the exception. And most studies have investigated the effect of mycotoxin when present separately. And we really need now to investigate the effect of mycotoxin co-contamination. What are the effects of this co-contamination? So the experimental design to study mycotoxin mixture, you need to have a two-step approach. First, you need to do a dose effect of each mycotoxin when used individually. And this is quite important. This is just two examples, two dose response examples. In the one on the top, you see that when you multiply the level of a contaminant by 2, from 2 to 4, the response is only increased by 13%. But in other example, in the bottom, when you go from 2 to 4, you increase the response by 11-fold. So you really need to first have a dose response analysis. And then when you have this dose response analysis for each mycotoxin, you can compare the predicted effect of the combination with the single effect of the combination. And then you can determine if they have no interaction or if they have synergistically or antagonistically. And the big problem is that many studies addressing mycotoxin interaction are very difficult to interpret because there is no dose response experiment. We did some experiment with mycotoxin mixture, especially on cell, on human cell or on porcine cell, and we see that in the vast majority of the case, we observe some synergy. Here it was with different trichotican done and 3-acetyl done and 15-acetyl done, 15 and 3-acetyl done and nivalenol done and fusarenol X, nivalenol and fusarenol X. And you see that at low concentration, in the vast majority of the case, the main type of interaction is observed is a synergy. So that really indicate that this synergy need to be taken into account. So now I go to my conclusion. So mycotoxin have multiple effects on animal, and among them, they are able to modulate the immune system. And the main consequence of this is in terms of susceptibility to infectious disease and in reduced vaccine efficacy. Something that I didn't show you also is that mycotoxin are able to alter the intestinal barrier function. Then the intestine is not a barrier anymore. And this has some consequence in term, especially in terms of pathogen translocation across the intestine. What I show you is that despite of the frequent co-occurrence of different mycotoxins, little is known about the interaction between these toxins. And also, something that is new is that there's more and more new fungal metabolites that are identified, emergent mycotoxin, masked mycotoxin, and now we really need to address their toxicity. And with that, I finish my presentation and I thank you for your attention and I'm open to questions. I'm going to remove my screen so I can see the question.
Isabel,
Now we don't see you.
no,
She probably left the stage.
it's possible. Yeah. Margot, can you help us to bring Isabel back?
Yes, Isabel is coming back. Here she is.
Great.
Margot is in
Thank you.
one.
Thank you. Yeah, Margot also, thank you very much for support. Isabel, it was a fantastic presentation. Thank you very much. It raises several difficult questions, or at least for me. And then we would like to ask you to help in answers. And the first question was, how do you test the immune response if you are struggling to find a good antibody titer to test? Antibody titers from dead vaccines are not very good.
So I think the real problem is that we don't know. So I agree that sometimes it's difficult to see antibody response to vaccination. And so then it's difficult to see how mycotoxin can affect the immune response. Because also maybe in this scheme, the mycotoxin will not target the antibody response, but they may also target the lymphocyte with proliferation. So I think, unfortunately, there's not one response that tell you what you should do to determine the effect of mycotoxin on the immune response, but you need to do several tests.
Do you have any advice on what type of vaccine to test, for instance, in chickens or pigs? Maybe you have already some experience, also field experience.
I think it's difficult because in laboratory, you need a vaccine where you know exactly how to measure the response to the vaccine. And in the field, it's much more difficult. For example, in laboratory, why I was using a model vaccine, it's not because I would have preferred to use a real vaccine than a model vaccine. But to use a real vaccine, you need the company to give you the antigen that is making the vaccine, and usually it's kind of secret. So it's why I'm using a model vaccine, because then I know exactly what I'm giving and it's easier to determine the response of the animal.
Thank you.
Yeah, exactly. The next question is, there is one article mentioning that T2 reduced the intestinal colonization, but enhanced the systemic distribution of this bacteria in the animal body. What would be the explanation?
That can be different thing, because it can really also, the problem of the immune response is you can have a local immune response that can be very different from the systemic immune response. So if you have a local and a systemic immune response that are different, you can have one effect locally on the intestine and a different effect at the systemic level.
Okay, thank you.
There is another question. When addressing the impact of mycotoxins on the response of the animals to any xenobiotics, you advise to always consider a combination of low doses of mycotoxins, as often happen in practical situations. What are the most relevant combinations?
Okay, the most relevant combination really depend on the feed that you are giving to your animal. For example, Fumonisin is only present on maize. It's never present on wheat. So it really depends on what you are using. And I think it's also depend what is your question, because if the question is it better to give non-contaminated feed than a contaminated feed, I'm not sure that you need to do an experiment. But when you need then to really understand at the mechanism level what is happening, then you need to have feed that is really well characterized, and you need to have control. For example, when you speak about mixture, if you really want to understand what happened, it's better to have a co-contaminated feed and also feed contaminated with a different mycotoxin. Then you can see the effect you are observing to which mycotoxin is it due. Because you can have an effect that is only due to one mycotoxin, or that is due to a mixture, and then you can observe a synergistic effect, for example.
Okay, thank you very much.
The next question is, do you think that swine and poultry immune system react differently to mycotoxins?
Overall, I don't think so. Now, you can have some slight difference, but basically the immune response is quite similar in human and in animal, and in different animal species.
So we would expect the same effect,
Yes.
right?
Thank you. Julia, I missed the question that you were asking the first time. I just want to avoid that I asked it double time. Can you please remind?
It was T2 article mentioned in T2.
Okay.
Yeah, and then
so then the next question is, it's known that fumonisins have very low bioavailability. Knowing that fumonisins are almost entirely remaining in the gastrointestinal tract, what would be the mode of action on the immunity?
That's a very good question, and that's even not only on immunity. It's true that it's estimated that the absorption of Fumonisin is only 4%. But Fumonisin have a lot of effect, not only in the immune system. It induced pulmonary edema in pigs, it induced leukoencephalomalacia in horses, and we still don't know why it has such an important effect with such a low absorption.
So it's still to study. Okay,
So,
thank you.
Still not known. Okay, the next question is how to measure efficacy of vaccination in the field? Probably you started to discuss this already, yes.
Yes, I would say the best way of measuring efficacy of vaccination is to have a challenge infection, but you never hope that you have a challenge infection, because you never hope that. So then a surrogate marker can be to measure the antibody response or the lymphocyte proliferation, because sometimes the vaccination is through antibody, and in some other case, it's more through lymphocyte proliferation.
Okay, thank you.
Yeah, we have many questions. They are popping up. The next one is use of toxin binder feed additive in poultry diet. What type of toxin binder is the most effective one? Very challenging question.
I'm not sure I'm the best one to respond to this question, but I think then it's also depend to the mycotoxin, because we know that mycotoxin are very different one to each other. So usually you can have separate different way to bind the toxin, but I think it was more the topic of the first seminar that you had before me.
Okay, thank you.
Yeah, you're right. You're right. It's not like the topic of this webinar, but still, yeah.
Yeah,
it
it's very
depends.
relevant. Many
Yeah,
customers
it's
are
very,
asking.
yeah, you're right. But it's again, it depends on the type of the challenge, the type of the mycotoxins, and again, right? Okay, the next questions is in a challenge model on swine, is there a recommended cocktail of mycotoxins to see any effect on immune response?
What I show you in my presentation is that a lot of most mycotoxin have an effect. So to my point of view, whatever the cocktail of mycotoxin you will use, you will have an impact on the immune response. And it's why it's very challenging, because unfortunately, you are not always sure to have free mycotoxin feed. And so you are sure that your animal will have a proper and the best immune response.
So no any recommendation, we can use any mycotoxin and we will definitely have negative effect on the immune system, right?
Most of the time,
Most of
unfortunately.
the time.
Yes.
And can you name the number one, like the most important for immune system mycotoxin for swine, for example? Any
There have been a lot of work on the effect of DON on the immune system and aflatoxin on the immune system. I think this is a mycotoxin that will have the highest effect on the immune system. Then I will put Fumonisin, and last I will put Ochratoxin on the immune
So
system.
DON is number one even in immune system, right?
Yes.
And is dosage important, because they have different toxic levels, the Fumonisin, Ochratoxins. For instance, if we would like to challenge swine or we expect some immune effect of Fumonisins, it would be the same level as DON and Ochratoxin, or we would need a lower or high level?
Yeah, dosages, please.
Yes, it's in most of the case, there is a dose response. The effect on the immune system is dose dependent. So the more mycotoxin you have, the more effect on the immune system you will have. So usually it's really deleterious, and the more mycotoxin you will have, the weaker your immune system is going to be, and then the more consequence you will have in terms of susceptibility to infection.
And if you would expect the same response of immune system from, for instance, 1 ppm of DON, 1 ppm of Fumonisin, or 1 ppm of Ochratoxin?
No. You have, in terms of potency, you have mycotoxin that are more potent than other. For example, Fumonisin, you need to use higher level of Fumonisin to get an effect on the immune system compared to DON. So it might also be related to the poor absorption of Fumonisin and the high absorption of DON, for example. But it's true that the effect on the immune system will not be the same on a milligram per kilogram feed basis for each mycotoxin.
Okay.
And we have next question connected with DON. What is the mode of action of DON on immunity? In which organ this takes place?
So what is the mode of action of DON? The mode of action of DON is, I would say there's two effects. The first thing is the DON will bind to the ribosome, and this will lead what we call ribotoxic stress. This ribotoxic stress will first give a very burst of cytokine, which is not always good, because when there is too much cytokine, that's not very good for the organism. And then it will decrease the immune system in short term, we have an increase of all cytokine, and long term, we have a decrease of the immune response. On which organ the immune system, the effect on the immune system will be very diffuse. because it mainly acts on lymphocyte, and there's lymphocyte all over the body. So it's more difficult to say if there's an organ specific for the immune system than for other pathology, because the immune system is very diffuse on all the organ, all the body.
Good.
Yeah. I have another question. How do the levels of mycotoxins used in your experimental models compare with those seen in commercial situations, either alone or in combination? Do they represent?
In the first experiment that I show you, the level that we use in the lab are usually higher than the one that we see in the field. But on the other hand, when I'm doing an experiment in the lab, I'm doing 1 or 2 experiments per year. So between 2 experiments, there is 6 months where the facility is completely empty, which is not the field situation. The number of animals per pen is lower than in the field situation. So I know that I'm using a higher level of mycotoxin, but this is still a model, because this is not the real situation where there is quite a lot of animal, that there is a lot of animal around. So I know that it's a higher level, but I think on the other hand, where we are handling the animal are also different from a real situation. But the lowest level are close to the maximum recommended level. So indicating that you can have an effect with, unfortunately, already recommended maximum level of mycotoxin.
Mm-hmm. If I may add my observation, when we make animal trials, of course, a number of animals is very crucial for getting a good statistical data, or significantly different data. So, and of course, in the practical conditions with thousands of animals, probably we can get much more visual results, having even lower levels of mycotoxins. But in the university, sometimes we are restricted to have a number of animals. And for instance, dealing with only 7 animals, we have to really bring a statistically significant data. And of course, we have to challenge animal more.
Yeah, to see the fast results, to see the differences, exactly. Okay, and we have another questions. What do you mean in your presentation by need to stimulate the immune response to be sure to be able to see the end effect?
What I was meaning is that basically the immune system is very strong. If you look at the antibody level of an animal with or without mycotoxin in the field, the total antibody level will be the same. It's only when the immune system needs to work, when it's challenged, that you see that mycotoxin will have an effect. For example, if you look at just the I'm going to take the example of antibody again, but if you look at antibody level, total antibody level on animal, you will need very, very high level of mycotoxin to see an effect. But if you vaccinate an animal and you look at the antibody level for this vaccination, here you have stimulate the immune system with the vaccination. Here you will need a much lower level of mycotoxin to see an effect. It's what I say that I need to stimulate the immune system. On the steady state level, the immune system, when the immune system doesn't have to work, you need very high level of mycotoxin to change it. But when the immune system is acting to fight an infection, to respond during vaccination, here the level of mycotoxin that is needed to alter the immune response is much, much lower.
Okay, thank you. And the same as you showed that when after vaccination you had challenged by viruses from the vaccination. Also, there was like stimulation of immune response, yes, and you were able to see the negative effect of mycotoxin, right? It's like again stimulation of immune system.
Exactly.
Okay, thank you.
And the bacteria and the coccidia can be also the same?
Yes.
Okay, challenging immune system.
Yes.
We still have a couple of questions and almost finished. What do you consider as low doses of mycotoxins in a combination approach?
What I consider as a low dose of mycotoxin is those that are close to the regulatory limit. Because I think the regulatory limit are very important, because this is the maximum limit that are tolerated in the feed. So if you have an effect with those doses, it means that they are not protective as they should be. Because the recommendation is based on the idea that if you follow the recommendation, you wouldn't have any effect, because it's why recommendations are made. So if you have an effect with this level, I consider them as low dose.
We have participants from different countries, and different countries apparently have different levels which are accepted for the feed. Does it mean that animals in one country are more resistant to mycotoxins?
That's not my field. That's the field of legislator who made the legislation. I don't know why in some countries they estimate that they can tolerate this level of mycotoxin, and in other countries they tolerate lower level. That's not a scientific problem, that's more a risk assessment problem.
I think the EU in that case is quite advanced. I heard that also EFSA is considering now to reduce the physiologically safe or accepted levels for the feed, that there is a discussion, and I hope that you probably can give some highlights on that as well to us, or is it still a secret?
No, I think it's true that in terms of regulation, Europe is quite strict, even more strict than most of the other countries. So EFSA did not decide to reduce the level or not, but it's true that from time to time the European Commission asked EFSA to reevaluate the mycotoxin, but also other contaminants with new data, and sometimes new data show that we have level, you have effect of lower level, and then if you show that, then you reduce the tolerable level. But this is quite normal. The more data you have, the more accurate effect you can have, and the more accuracy you can see at this dose you have an effect, or at this dose you have no effect.
Okay, thank you very much.
And we have a couple of questions left. So one of them is there an effect of age on the response of the immune system to mycotoxins? What are the most critical situations? Youngs, breeders, or else?
Usually, but in general, not just for mycotoxin, but young animals are very susceptible to infection, because young animals, usually their immune system is not completely mature. And for example, to have a completely mature immunity, you would need to wean pigs around, I think, 6 weeks of age, which nobody does. So usually younger animals are more susceptible because their immune system is not completely mature. And you also have a problem with very old, but this more for human, because usually you don't keep farm animals that very old.
What about breeders, for example? We are keeping them
Yes,
a little
but
bit.
even breeders are not as old as elderly people.
Okay.
Can they give their immunity to their offspring?
It depends. Sometimes yes, sometimes no. It's either through the placenta or through the colostrum. So that's, but this is true that people try to give the immunity from mother to offspring, which will be very good for the offspring when they are born.
Meaning that if the animals like breeders has mycotoxins in their feed, so they have some negative effect on immunity, and this immunity will go to the chicks, to the progeny.
That have been demonstrated, for example, for aflatoxin. If it has been, there are some papers showing that when mother were fed with aflatoxin contaminated feed, there was a decreased immunity on their offspring. But it's really taken on mycotoxin. I think for Don, it has never been demonstrated, neither nor for Fumonisin, but it has been demonstrated for aflatoxin.
But does it mean that it's not true? Or it's just not be demonstrated?
It's not been demonstrated, so
Yes.
It's a potential topic
Potential for the new research. Good.
Exactly.
Okay, last question, and then we will wrap up because I have a message also to participants. The last question is, do you think that a combination of doses below limits might be significant? You mentioned synergistic effect.
I think this is a real question. And this is a big topic to know whether, and it has been demonstrated for some mycotoxin, not always for the immune response, but that when you have all the mycotoxin at the maximum limit, you still have some effect. So it really indicates that there is an interaction between the different toxins.
Okay, thank you very much.
Last question, just about the synergy. Isabel, do you know how can we, do we have any issues or any possibility to calculate the synergism of different mycotoxins? I know that there is some equation, some methods, but we don't use them in the practice. Maybe you have any comments?
That's very complicated, because the problem of the synergy is really it's on its infancy. We don't know much, and so far all the regulatory limit or everything, they don't consider synergy, they consider additive effect. And even if you look, for example, from EFSA, most of the time now it's not regulated mycotoxin by mycotoxin, but family of mycotoxin. For example, it's aflatoxin B1, B2, and M1 that are regulated together. Fumonisin B1, B2, now it's done and modified form, zearalenone and modified form. So now we have a group TDI for all this mycotoxin, but most of the time it's done. You consider that it's with additive effect. We don't consider synergy because it's too complicated. And if I want to make the story even more complicating, Julia, is that we are not only exposed to mycotoxin. And for example, in our lab, we found interaction between mycotoxin and heavy metal.
That's
mycotoxin
interesting.
and cadmium, for example. So we are not just exposed to mycotoxin.
And cadmium at really high levels or just elevated levels?
So now we go at levels that are plausible in the feed.
Really?
So, yes.
Wow.
That's
interesting.
That's even more complicated for the story.
Wow.
Yeah, exactly.
Yeah.
Okay,
let's wrap up. I would like to thank you, Isabel, very much for precious information that she shared with us, and also answering the challenging questions and giving a very valuable information. So we will wait for participants for another session, but I also got some messages that some people were joining late today, and they would like to get a record of the presentation. I would like to say that there will be a replay of this session next Tuesday at 3 o'clock Paris, Brussels time. So, and those people who were missing some talk of Isabel can also see the records next Tuesday. You can register for that. So thank you very much. And I wish you a very nice day, evening, and hopefully to see you soon back.
Thanks a lot, Isabel. Thank you.
Okay,
Have a
bye.
good day.
Bye-bye.
Everyone.